plans to get sick or hurt, but most people need medical care at some point. In rural areas, hospitals can be few and far between, posing significant barriers for residents. That's why the University of Nebraska Medical Center has its eye on improving the future of healthcare in the heartland. UNMC is a world leader in medicine, and tonight you'll learn how they're making big strides, bridging the gap in healthcare access. Good evening and welcome to Rural America Live. I'm Christina Loren. Joining us tonight, we have a panel of experts from UNMC. We welcome in Dr. Jeffrey Gold, Chancellor of the University of Nebraska Medical Center and the University of Nebraska at Omaha. And we also welcome in Dr. Juliann Sebastian, Dean of the College of Nursing at the University of Nebraska Medical Center. And also joining us tonight is RFD-TV founder Patrick Gotch. Everybody, welcome to the show. All right, well, let's get right to it. Tell us a little bit about your background, Jeff.
Well, thanks for asking. People refer to me as a nearly recovered heart surgeon. So I grew up in the inner city of New York, was privileged to go to engineering school at Cornell and then med school, trained in general surgery, then in adult cardiac surgery, and finally in children's heart surgery in the Harvard system in Boston. Spent over 20 years of my life fixing little babies' hearts, you know, no bigger than a walnut. And then about 15 years ago, became a medical school dean. Shortly thereafter, became a university provost. And I'm now in my 5th year of serving as the chancellor of the University of Nebraska Medical Center.
Excellent. Well, we welcome you in, and tell us a little bit about your background, Julie.
Well, again, thank you, Christina. I'm originally from Kentucky and spent many years at the University of Kentucky. Kentucky is a state much like Nebraska with a number of urban areas, but also many rural areas. My own background is in public health nursing, and as a public health nurse, we learn to reach out to our communities. That's part and parcel of what we do, and it has fit so well in Nebraska.
You know, you talk about reaching out to communities, and that is something that our own founder and CEO, Patrick Gotch, that you're known for. You really do care about rural issues.
Yeah, and there's no issue more important to rural America than health, you know, along with education and rural development. But health is up there. We've been trying to address this for a long time, been looking for the right partner. Tonight's show is a result of a chance dinner that Dr. Gold and I had with a mutual friend a few months ago, Mike Annie in Omaha, Nebraska. And we connected right away, and I explained to Dr. Gold how we were challenged in trying to find people that would help us reach out to all these volunteer firemen and rural doctors and rural nurses and all the challenges that are out there in rural America. Like I said, I've been searching for a long time, and the answer is right under my nose. I live right outside Omaha, Nebraska. Here it is. But once Mr. Yanni brought me and Dr. Gold together, then this all has come together very quickly. I'm extremely excited about the possibilities for where this potential partnership can go. And I just wanted to come on for a few minutes and thank Dr. Gold and Juliann for taking the time and making the effort to come to our studios tonight. We want to try to kind of open up the phone lines and open up the conversation, see where this goes, and then, like I said, we hope this is the first of many things that we're doing with the University of Nebraska Med Center.
Excellent. And like Patrick said, we are going to be opening up those phone lines. Remember, you're a big part of this show. In just a little bit, we will be taking your calls live on the air, and we want to hear from you tonight. What's the quality of health care where you are in rural America? Let us know what's working and what's lacking. And of course, our panel of experts will also answer any questions that you might have. We are going to be opening up the phone lines soon, but first, tonight's topic is how to better meet the needs of healthcare for rural Americans. Let's start with some background on UNMC and your focus.
Sure. Well, the University of Nebraska Medical Center, UNMC, is part of the University of Nebraska system, which means the system goes back about 150 years. We've been around for a long time. As a matter of fact, next year we celebrate the 150th anniversary of the founding of the medical school itself. So as a result of that, we are focused on education, we're focused on research, and we're focused on clinical care. In education, we not only have a College of Medicine and Nursing, but pharmacy and dentistry, allied health, public health, and graduate studies. We do well over $100 million a year in research that spans everything from molecular and genetics to population health in both rural and urban communities. And on the clinical side of the equation, we're partnered with many hospital systems, but our primary partner, Nebraska Medicine, serves the state and the region of Nebraska. And we are focused on our 500-mile-wide campus. So while our main facilities, almost 10 million square feet, are located in Omaha, we span all 500 miles out to Scotts Bluff, and we have multiple rural and urban campuses. We have multiple rural and urban sites of education. And so we are very focused on this question of understanding what the urban community needs are, but also marrying that to a good understanding of what the rural needs are as well.
Let's talk about some of those rural needs. What do you think are the biggest concerns that rural Americans have when it comes to healthcare issues?
Well, I think one of the biggest issues is access. There are a number of ways to think about access to health care. One is by geography and thinking about the distance to the nearest healthcare facility. And yet another is to think about the numbers of health professionals who live in your community, who staff the local hospital, who staff the clinics, who provide care in the offices, who are members of your community, neighbors, and who care about your health. And so one of the things that we think is very, very important is educating the workforce for the future of rural care.
Absolutely. Now, we think about rural Americans. We know that you are the hardworking people who feed and fuel the world. A lot of this is manual labor. Patrick, you know you worked on a farm. Your brother still has a farm. Talk about some of the issues that you're going to find when it comes to health care of rural Americans versus urban Americans.
Well, we've reached out to the rural communities, particularly in Nebraska, to ask the question of what is the role of academic medicine, of large hospitals and clinics and educational facilities. So we recently, in the last year, met with almost 250 people face-to-face in focus groups and one-on-one. And we said to them, what are the biggest challenges that you're having? What are the things that are working well? What are we doing too much of? What are we not doing enough of? And then, and if you think about it, and we focused on, for good reason, on the year 2030, what do you think your needs are going to be in 2030? And how can the University of Nebraska Medical Center start to understand those needs better and therefore build programs? And we got a whole spectrum of answers, everything from educate more and different sets of skills into healthcare professionals, more teamwork, what we call interprofessional care, a much higher reliance on technology, think telemedicine, think wearable devices and that sort of thing. Geographic access and communication is very important. That is to say, if I need help, who do I call? How fast can I get a response? You know, I recently had an opportunity to ride on a corn combine and in a field out in western Iowa not too long ago. And these are big pieces of equipment, and I'm sure that, you know, farming and ranching accidents are not uncommon. I can tell you they're one of the major causes of trauma in the state of Nebraska. These are dangerous businesses to be in. Yeah. And people need to know that if something happens, if they need help, either for a minor injury or a serious injury, they're one phone call away from getting that help. Cost always comes up. It's not just personal cost, but a lot of the large farmers and ranchers worry about the individuals that work for them. What is it going to cost them to provide health care and get access to health care? And can they keep their community hospitals and their physician practices vibrant? So we got quite a bit of messages about what we can do as a university to try to help.
I think one of the important things about this effort, I was privileged to be part of that task force, and it really expressed, the way we went about that work expressed what we think about working with people, whether it's one patient or a group of people, and that is you listen. We could have put our ideas together pretty easily, but to hear what people care about and what is very important to them really shaped the way we thought through this plan.
Absolutely, and that's part of the reason why we're having these shows on RFD-TV. Patrick, you mentioned it at the top of the show. We want to hear feedback. We want to find out what's working and what's not working, because if we don't hear, right, how can we solve it?
No, I've said this many times. When we launched RFD-TV 18 years ago, we had two goals in mind. One, of course, was to serve the needs and interests of rural America. And number two was to reconnect city with country again. And if there's one thing that I think discourages some people from staying and living in rural America, they love it out there. It's great for their families. They're great communities. There's a lower cost of living. But two things. One would be broadband in rural America that is being addressed by the FCC and others to make speeds, internet speeds in rural America as good as they are in the urban areas. Number two would be healthcare. You know, and I'm so excited to see Dr. Gold and Juliann and everybody at the University of Nebraska addressing this. I hope you have time tonight to get into some of their history, like with the Ebola virus. I mean, this is a first-class operation. The Buffett Cancer Center that just was opened in Omaha a short time ago. But to see the focus from people, and I can tell in 2 minutes that people really do understand rural America and are sincere and passionate about serving it, and it's definitely here. This is going to be exciting, and again, I hope the word spreads, and especially all the professionals in rural America that are involved with volunteer fire departments and doctors and nurses and everybody kind of get together, because here are people that can really help solve the problems for healthcare in rural America, as long as internet speeds get up there.
Well, but you know, Patrick, these things are tightly tied.
Yes.
Because the delivery of healthcare in both rural and urban communities is going to increasingly depend on technology. Right. Images, x-rays, scans, even just a photograph of a lesion on your skin. And it's going to require high bandwidth, reliable internet in order to get that done in a safe and reliable fashion. You know, in the healthcare world, the internet connectivity can't work some of the time. It's got to work when we need it all the time.
Okay, well, we are just getting started. We appreciate you coming on, as always, Patrick.
I'm going to go answer phones for a while.
Okay, you got a busy job tonight, because we know we're going to get a lot of calls. And so we will pause for a quick break, but stay with us. When we come back, we're going to talk about the shortage of healthcare providers in rural areas and what's being done to change that. Plus, we want to hear from you. Our phone lines are now open. Give us a call at 877-731-6733. Again, that number, give you a second to grab a pen, 877-731-6733. Call in with your questions for our panel, or let us know about the quality of health care where you are in rural America. What's working and what's lacking in your part of the country? Join the conversation on the other side of the break. More Rural America Live right after this. Welcome back to Rural America Live. I'm Christina Loren. In rural areas, hospitals can be few and far between, posing significant barriers for residents in need of medical services. Tonight, we're talking about ways to improve rural health care. Joining us is Dr. Jeffrey Gold, Chancellor of the University of Nebraska Medical Center and the University of Nebraska at Omaha, and Juliann Sebastian, Dean of the College of Nursing at the University of Nebraska Medical Center. And we're taking your calls live. Join the conversation tonight. Give us a call at 877-731-6733. Again, that number is 877-731-6733. Call in with your questions about rural health care, or let us know what needs to be improved or what's not working in your area, along with what is. We all know that access to health care is a critical need in rural areas, but how bad exactly is the shortage of health care workers?
So, Christina, there are basically 4 challenges we face in all of healthcare, in rural America, in urban America, et cetera. And that's access, as you said, workforce, geographic distribution, meaning by specialty, and then, of course, cost. And they're all interrelated. We're facing workforce shortages in cities and in rural America, but particularly in rural America is where it's most felt. And that's not only in primary care specialties, but it's in the complex care specialties as well. Everything from pediatrics to women's health to all of the advanced care specialties. We have an aging workforce, which has been, you know, a good thing for the individuals that we're aging, of course, but not so great for the communities that we serve, because it'd be nicer to have a broader distribution of the generations as well. And we have silos of care. That is to say, we have doctors that don't necessarily work together with their nurses all that well, and nurses that don't work with therapists, et cetera. And that's getting better, but those are all challenges that we have. Now, here at UNMC in Nebraska, we've taken a very comprehensive approach to this, and we're very well known as one of the largest institutions that's focused on training of healthcare professionals in rural communities. And there's been no area that we've been more successful in training in than in nursing. And maybe Dean Sebastian can weigh in on some of that.
Yeah.
Thank you very much. Well, the numbers of nurses, the supply of nurses has increased dramatically throughout the entire country over about the last 12, 13 years. And yet the shortage persists. The shortage of nurses affects rural areas really more than it does many urban areas, and I'll share why in just a moment. But the shortage persists, in part because we're finding that demand is increasing. As people get older, they require more health care, and there are a lot more opportunities for nurses to provide care in a wide variety of settings, and so they're distributed across a lot of different areas. But in a rural area, using nursing as an example, if you have a vacancy of one nurse in a critical access hospital and it takes months to a year maybe to fill that position, that has an enormous clinical impact on that facility. So it's a very important issue, and one that we've been working hard to expand our programs, to make sure they're distributed around, in our case, around Nebraska, and make sure that students have access to education using technology, which makes it more accessible.
You know, how do you incentivize these students to, once they go out and get their college education, to come home and work in rural areas? Because, I mean, I could see all the fancy bells and whistles at a big hospital in Washington, D.C. or New York City. How do you get them to come home to small town Missouri?
Well, there are several ways of doing that. One of the most important things is to find young women and young men from those communities whose parents and grandparents, brothers and sisters live in those communities, so they understand the community and feel part of it. And then providing them frequently with scholarship support so that their undergraduate education as well as their graduate and professional education becomes more affordable. And then make them feel welcome to go back to their community. We've done this through our RHOP programs, Rural Health Opportunity Programs, now for well over 10 years, where we take students from rural communities. They attend state colleges in rural communities, usually with tuition-free attendance, and then they matriculate into nursing school or med school or dental school or whatever. And as a result of that, you know, if you look at the rural communities in Nebraska, approximately 90% of the doctors, dentists, pharmacists, et cetera, are graduates, alumni of our university because of these very, very specific programs.
That's a high percentage.
Well, it really is. And if I can just give one other example, I think that's important, and that is that, you know, all of our students have an opportunity to rotate in rural communities. So, you know, there are mandatory requirements, and even students that grow up in big cities, when they have an experience in a rural community, they first of all, they all love it because of the opportunity to bond with the system, with the community, et cetera. But many of them decide that that's going to be their career, even though they don't have their parents and grandparents and brothers and sisters in the community. So having that exposure and having a university educational system that creates these experiences for these young women and young men is also critical.
Absolutely. Okay, we're going to go to the phones and talk to Sue from Nebraska. She leads us off tonight. Go ahead, Sue. Thanks for calling.
Hi, thanks for taking my call. I have a question for the panelists. My husband is a farmer, and we're concerned about access to mental health services. We're wondering, what is UNMC doing in Nebraska to improve services for mental health and specifically opioid addiction?
Well, Sue, thanks so much for that great question. And as you may or may not know, that Nebraska has an opioid task force that's specifically focused on reducing the burden of opioid addiction and opioid prescriptions in the state. UNMC has extensive programs in behavioral health. As a matter of fact, the majority of our telehealth programs are in behavioral health. I think we now serve between 50 and 60 different communities, both rural and urban. And interestingly, the patients really love it. They prefer to have access through a telehealth type of connection. They feel comfortable and confidential and secure. But as is true in the state of Nebraska, is also very well true across the country. There are very significant shortages of behavioral health professionals, and it's a challenge, I mean, to be very open with you, and we're working on it completely and quite intensively. Julie, maybe you could talk a little bit about some of our behavioral health nursing programs, if that would be okay, because that's another big focus. Yep.
Absolutely. A few years ago, we expanded our psychiatric mental health nurse practitioner program using a variety of internet-based and video-based strategies so nurses throughout the state and in other states could more easily participate. University-wide, we have a program not located in nursing, but university-wide, called Beacon, the Behavioral Health Education Center of Nebraska. And a lot of the work Beacon is doing is to embed behavioral health strategies in all areas, all specialty areas, and even in schools and neighborhoods, because we all need to be aware of behavioral health and the roles that we each have to play in basically taking care of one another.
I love how it's such a talented group of people, yet so selfless as well, and that's very hard to find these days. So definitely University of Nebraska Medical Center, that's what I've seen. That's my first impression.
We call it Nebraska Nice.
I like Nebraska nice. Okay, thank you so much for that call, Sue from Nebraska. And that leaves a line open for you to give us a call. Join the conversation, 877-731-6733. Again, the number to call is 877-731-6733. Next, we're going to go to Chris from Iowa. Thanks for the call. Go right ahead, Chris.
Hi, good evening. My name is Chris. I'm a pharmacist from the University of Iowa. And we actually put together a clinical pharmacy team utilizing telehealth to increase access to care for patients across the state of Iowa to start with. And we actually studied this in two large National Institute of Health research studies over a 5-year program and found that we were very capable of integrating our clinical pharmacists into primary care, and really with hopes of reducing cardiovascular disease and improving access to care for patients. So just providing another option for increasing that access to care for patients and using the telehealth platform to make a successful way to do that.
So that's, Chris, that's really very important. And we've had similar experience of not only embedding pharmacists for purposes of medication management, which is also critically important, but we've also worked very hard on embedding behavioral health specialists in primary care practices in both rural and urban parts of the state. And we found that that combination of pharmacy, medication management, behavioral health, and of course primary care seems to be part of the magic recipe that works so well. You know, unfortunately, as I'm sure you and your colleagues know, but the rest of our audience may not, a very significant percentage of prescriptions written in the United States are never filled. And a very significant percentage of those that are filled are never finished. And of those that are finished, a very significant percentage are taken wrong. You know, you take them once a day instead of twice a day, or something along those lines. And so having solid medication management resources, having good pharmacy backup is critical to improving the health of our nation.
Excellent. Thank you so much for that call, Chris. We appreciate you sharing your story as well. We're going to go back to the phones now and talk to Ron from Iowa. Go right ahead, Ron. Thanks for the call.
Well, thank you. I appreciate you taking me. Doctor, my wife passed away 4 months ago, and meanwhile she took 33 chemo treatments before the clinic decided it wasn't working. And to help resolve a question mark above my head, why couldn't this have been done at 10 treatments and made a change in the solution or go another direction? Can you help me understand that? Thank you.
Well, first of all, I'm really sorry to hear that your wife passed, and our very best wishes to you and your family. You know, if this was for cancer, every patient is different. Every diagnosis, every cell type, every patient is genetically different. And as a result of that, they respond to chemo in different ways. And while I'm not a cancer doctor, I can tell you that I've had enough family experience and enough professional experience to know that you can't predict how people are going to respond to treatment for cancer. And sometimes it's almost a bit of trial and error. There are standard protocols that are used for lung cancer, breast cancer, colon cancer, et cetera. But we need to be flexible enough that if they're not working, that we change them. Through the Buffett Cancer Center and the research that we're doing, we're continually trying to find better treatments, earlier diagnosis, screening tests, et cetera. Unfortunately, it won't help your wife, but I hope that the things the doctors learned and the physicians and the nurses learned from caring for her will help other patients in the future.
Beautiful, comforting words. God bless you, Ron from Iowa. Thank you for that call. We're going to go back to the phones now. First, I want to give out the number. 877-731-6733 is the number to call. We want to hear from you tonight. 877-731-6733. Now we're going to talk to Patsy from Missouri. Thank you so much for the call. Go right ahead.
Yeah, I just wanted to let the doctor know that my husband had been in the hospital there in Lincoln for a month because his kidneys quit, and they had to operate on him and take one kidney out and all this. And anyway, he got very good care from the doctors and the nurses. And I was with him every step of the way. So the hospital is wonderful, and so are the clientele.
Well, thank you so much for those kind words. It really means a lot to us. We talk about our health system as serious medicine and extraordinary care. And it shouldn't be lost on anybody that patients really don't care what you know till they know that you care. And I think you're just reiterating that with different words. We're very blessed, and I think many, many medical centers across the country are very blessed with healthcare professionals that want to make sure that patients and families have the very best experience as they're facing complex and challenging illnesses. And we in Nebraska understand that, when it's a member of our family who needs it, it becomes very personal. And that's the level of care that we try to deliver for all of our patients. And thank you for those kind words. I will actually share them when I head back.
And I might add, I think it's a wonderful thing to hear you say that you were with your husband every step of the way, because truly healthcare is a family affair. Family and loved ones who pitch in together and who help the person who's receiving treatment. And so thanks to you for your involvement in your husband's care.
Absolutely.
Good point. Okay, we're going to go back to the phones and talk to Lisa from Nebraska. Thanks for the call, Lisa. Go right ahead.
Thank you. Hi, Dr. Gold and Dr. Sebastian. It's nice to see you guys on TV. I was wondering what UNMC is doing in terms of, I know they're doing a lot for focusing on treating disease, but what about preventive care, health and wellness in the rural communities? What types of things is UNMC doing for those things?
So we're doing quite a bit, and thanks for that great question, Lisa. We have, through our College of Public Health, we are tightly working with all of the public health agencies in every county in the state. We're focused, of course, on making Nebraska the healthiest state in the United States. And by that, we're looking at everything from obesity to alcohol. We're looking at diabetes care. We're, of course, looking for screening and early detection for cancer, childhood immunizations, just a very, very broad spectrum of lifestyle-related issues. And to the very top of the list, of course, would be tobacco cessation. If there was one single thing that an individual could do, would be to reduce the amount of tobacco they consume or to eliminate it. Because it's not just lung cancer. It's everything from emphysema to heart disease to stroke and a whole spectrum of other diseases that come from it. And I know that's not the easiest thing to do, and it's a lot easier to say than it is to do, to give up tobacco. But there are really good therapies and medications now to help folks do that. So we are very focused on prevention and wellness. And maybe, Julie, you'd say a few words about what we're doing for prevention and wellness for our own healthcare team.
Oh, absolutely. Well, one of the things that we are concerned about for healthcare professionals and for students in healthcare is well-being. We're very concerned about ensuring that students and clinicians, faculty and staff, and the alumni who are serving as clinical preceptors are all able to take care of their own health and to deal with even though the work we do is impactful and it gives us great joy and satisfaction to work with people, there is pressure involved in providing the very best care to people. And so we're providing a number of ways to help people within the medical center and our community partners promote wellness. And I will add that we're teaching these skills to our students as well through the work they do with health fairs, with a variety of health promotion activities. We want them to know from day one that not only do we work in communities to help people promote health, but we try to take care of our own health, that we are part of the equation as well.
Excellent. Okay, we're going to go back to the phones. First, I'm going to give out that number, 877-731-6733. The number again, 877-731-6733. That leaves a line open for you. And we're going to hear from Connie from Wisconsin next. Thanks so much for the call. Go right ahead, Connie.
Yes, hello there. Thank you for taking my call. First of all, I'm not trained in healthcare as a healthcare professional, but I've taken care of my family as a caregiver for cancer. And I am in a literacy task force group in Wisconsin. And in Wisconsin, our Wisconsin Health Literacy organization sponsors a program called Let's Talk Medicines. So when Dr. Gold talked about prescriptions not taken, not finished, taken incorrectly, I go out and I do presentations to senior citizen groups. And it's all scripted. It's written by doctors and pharmacists. And we do these presentations around rural Wisconsin. I live in the North Woods. And I was wondering that within the University of Nebraska, if they have a component in their curriculum on health literacy, and also do they provide training for lay people such as myself. I also have been trained in basics of cancer care. So we're looking at that, and now I've been asked to do opioids, and I know you just mentioned that. But do you have these components in your curriculum, and also do you train lay people in such a fashion?
So the short answer to the questions, Connie, are yes and yes, but most importantly, thank you so much for everything that you're doing. Health literacy is an area that is absolutely critical. And, you know, we need to do a better job in delivering health care. I think we can do a better job in creating health literacy and making people better patients. I think having people understand the questions that are good questions to ask, having people understand how to take their medications, you know, knowing when a midnight call to the doctor or nurse is important, or a visit to the emergency room, or when it's not. And, you know, all new parents go through that with their babies, and trying to figure out when it's a life-threatening emergency and when it's just colic. But that's true about everything from well child care all the way up through advanced cancer care, certainly heart disease that I dealt with during my career as well. So we have students that do a huge amount of community service, and one of the things that they do is related to health literacy. They go out into rural and urban communities, and they talk to these communities about their health, about what they can do to prevent disease. They talk about screening and early detection. Then they talk about therapy, follow-up, and care. And we do a good deal of that across all the health professions. But there's probably no group that does it more intensely than our nursing students do. Wouldn't you think, Julie?
Well, it certainly is a critical part of what we do in nursing in terms of coaching people and working with people in communities such as yourself. It's really exciting to hear you talk about the work you're doing around health literacy and the way you're reaching out in so many ways, for example, around opioids. We know that as the future unfolds, more and more, not only will we be working with caregivers of people who are our patients, but we'll also be working with people in the communities. Again, we're caring for one another. It really does take a village. So we thank you for your fantastic work, and we're really quite proud that all of our students, and speaking from where I sit, the nursing students, are involved in this kind of coaching and helping people understand health literacy.
You know, if I can follow up just for a second, you're the second caller that brought up a comment about opioid treatment, prevention, et cetera. We're at a crisis stage in the United States right now. Last year, more people died from opioid-related overdoses than died from motor vehicle accidents on our roads and highways in the entire country. And that doesn't count all the hospitalizations, near misses, and all the lives that have been destroyed through opioids. And there's a lot of misinformation out there. People don't understand that pain medication carries with it tremendous benefit for treating patients that have serious pain, but it also carries with it a risk. And your willingness to go out in the communities and carry this information, which of course is the responsibility of every physician, nurse, pharmacist, dentist, everybody who prescribes opioids, is critically important. And we're going to need to double down our efforts to be sure that we can get our hands around this, or these tragic components are going to continue to build in our society.
I like how Julie pointed out, it takes a village. We all have to work. We all have a role to play in all of this, so it's great.
And even just talking about it tonight is part of that role.
Awareness. I think that was Patrick's intent the whole time. Okay, we're going to go back to the phones and talk to Don from Minnesota. Go right ahead, Don. Thanks for your call.
Yes, I'm in room 76 in the Cancer Buffett Center. I've been coming down here for 10 years plus, and just like to thank all the people, the good research, everything, unbelievable care, personnel, and everything that you two have put together here in the center here. I'm awaiting tomorrow morning at 10 o'clock. I will be getting my I'm the first one to get CAR T cells for B mantle cell non-Hodgkin's lymphoma. So there'll be a whole team of people, of course, that will be on me here, and the whole thing is so greatly appreciated. And I have told numerous people of your great system down here and everything you do.
Well, certainly, first and foremost, we wish you the very best with your therapy. The results from CAR T therapy have been nothing short of spectacular, and we wish you the very best as you continue your journey through your lymphoma. You know, we're very proud of the Buffett Cancer Center. The Fred and Pamela Buffett Cancer Center was opened just literally over a year ago. It's about 650,000 square feet. It's combination research and clinical care. And it was named to memorialize Fred Buffett, who passed away at an early age from kidney cancer, actually. But it really is, as we said a few minutes ago, it takes a village. And so this is not just our great doctors and nurses, but it's our research scientists, our pharmacists. It's the environmental services people who clean the rooms and maintain the grounds. It's the people that do the research that make CAR T therapy possible. Wow. And at some point, sir, CAR T therapy is going to become the standard of care for cancer, for both all, not just leukemias and lymphomas, but for solid tumors as well.
You know, it's hard to believe that of all the things that Don could be thinking about right now, everything that he's faced with, you know, his family, where does he go from here? He called to say thank you. That's what he chose to do with this moment in time. That's got to feel pretty good.
It's an amazing feeling, and it's one that I will pass back to the people who run the cancer center. You know, one of the things that I love to do, as Julie knows, is walk around the campus at night on weekends, talk to students, talk to nurses, talk to patients. And the theme that we get is this caring theme, the same thing that Don expressed. Not just, you know, CAR T therapy, there's just a handful of centers in the United States that are doing this type of therapy right now. But it's not just about the right medication and the right research. It's about bringing that together in a caring and family-like environment. As a matter of fact, that's the phrase I hear most often. I feel like family. And that matters when you're facing something as serious as cancer.
Absolutely. It brings a little bit of hope as well to all of us who listen to that, because you know what, if you can be in a situation that feels grim, you know, when you don't have a lot of certainty going forward, just to know that if they were to go to the University of Nebraska Medical Center, that they're going to get that family environment, they're going to get the best care that you possibly can, world-class facility. And that really kind of blows my mind because there's so many things that you guys could be focused on, and you're focusing on rural needs. And that's a beautiful thing as well. Okay, we're going to talk more about that coming up. We're going to pause for a quick break first. Stay with us. When we come back, we're going to talk more about high-tech solutions that are being used to bridge the healthcare gap for rural Americans. Plus, we want to hear from you. Our phone lines are wide open. Give us a call at 877-731-6733. That number again is 877-731-6733. Call in with your comments, your questions for our panel, and stay with us. More Rural America Live right after this. Welcome back to Rural America Live. I'm Christina Loren, and tonight we are talking about ways to improve rural health care. Joining us in studio once again is Jeff Gold, Chancellor of the University of Nebraska Medical Center and the University of Nebraska at Omaha, and Dr. Juliann Sebastian, Dean of the College of Nursing at the University of Nebraska Medical Center. And we're taking your calls live. Join the conversation tonight by calling 877-731-6733. Again, the number to call is 877-731-6733. Call in with your questions about rural health care, or let us know what needs to be improved on or what's working in your area. All right, we're going to go right back to the phones and talk to Susie from Philadelphia. Thanks for the call, Susie. Go right ahead.
Hey, hi, I'm Susie from Philadelphia. I'm a nurse and I make a really good wage. I'm thinking of moving to Mason City, Iowa. How can I put my nursing skills to good help to help in a small town like that? I know there's a small medical center. I'm concerned. Will I take a huge pay cut?
Well, you know, I can't speak for Mason City, Iowa, and I'll let Dr. Sebastian answer this question, who really knows the answer, in a second. But I can tell you the need for health professionals in large and small rural communities is huge across the United States. So I'm absolutely sure that you can find a way to put your skills and knowledge and experience to work. But Julie, what do you think?
Well, I think they will be thrilled to hear from you. I think they'll be absolutely delighted, Susie. No doubt, whatever your area of specialty is or your preferred type of nursing, you'll have an opportunity. And in terms of pay cut, I think that what you'll find, of course, I don't know Mason City, but I believe what you'll find is that you will receive very competitive pay for that local community. You never know if it's going to be cut from what you have right now, but I think in terms of it seems unlikely, but in terms of the cost of living in that local community, I think that you'll find that nurses are compensated well. Nurses are in such high demand that the compensation and the working environment is generally very good, and we're appreciated. And I know that they will appreciate you moving to Mason City.
You know, you ask a very important question, which is really the comparability of pay scales for health professionals in rural communities. And our experience is they're quite comparable. And not only are they comparable, the cost of living, as Julie says, is frequently somewhat lower, but the quality of life is really amazingly good. And I think you'll find it a very positive experience. If not, call us.
Right. Okay, we are going to go back to the phones and talk to Johnny from Los Angeles. Go right ahead with your question. Thanks for the call, Johnny.
Yes, thank you. This is to the panel. I have 30 years in emergency management for free hospital care, paramedic program, and things like that. And I wanted to know, how are you guys maximizing in the decentralized medical access for pre-hospital care at the grassroots level, as far as distributing point for disseminating information and providing for pre-hospital care?
So it's a great question, because there's a continuum of hospital care that goes from pre-hospital care through the hospitalization and then into post-discharge care, which can either be in a facility at home, frequently involves some sort of physical therapy or rehabilitation or occupational therapy. And so having a comprehensive approach to the continuum of care is critically important. So I guess the answer to the question would be it depends, and it depends because on very much on what the purpose of the hospitalization is. You know, we're a level 1 trauma service, and so frequently there's very little pre-hospital care other than that which occurs in the ambulance or in the helicopter on the way, which has to do with stabilization and pain control and things of that nature. For our more elective procedures, such as the patient who called previously who was getting treated for cancer, there's a tremendous amount of pre-hospital care. You know, I like to tell our students and our communities that our best job is to keep people out of the hospital. So if we're really succeeding, it's all pre-hospital care. So it's all outpatient care and preparation for when and if it becomes hospital care, and then keep getting people out and keeping people out.
Okay. All right. Thank you so much for that call. We appreciate it, Johnny. And that leaves a line open for you, 877-731-6733. Again, the number to call is 877-731-6733. We've had a lot of great calls so far tonight. I just want to pause from the calls for just a moment and ask you about the Helmsley program.
Well, you know, I was thinking as you were speaking, Jeff, about the pre-hospital care, that another way of thinking about it is the work that's being done with the SIM Nebraska trucks, funded by the Helmsley Foundation through the grant that is held at the university. A great way of training paramedics, emergency medical technicians, and nurses who are receiving patients from ambulances in the hospital setting. So maybe you could share a little bit more about it.
Sure. Well, we've been working very closely with the Helmsley Charitable Trust to build a program called SIM Nebraska. And the idea is pretty simple, is to take 4 very large trucks and make them mobile simulation teaching facilities and put them on the highways in the rural communities. And so we visit almost every critical access hospital, and we're particularly focused on emergency responders, paramedics, the people who volunteer their time, who work in filling stations on farms and raise cattle and in these large and small rural communities, who when the whistle blows or they get the emergency call, they give up everything they're doing, they jump on the ambulance and they go out and provide emergency care, and then triage the patient to the local trauma center or hospital or wherever the right destination might be. And so these people have educational needs also. They want to maintain their skills, particularly for things that they don't do very often. And so what SIM Nebraska does is it brings this training to them. And by the way, we don't charge for it. It's a free service. I shouldn't say it's free because it's paid for by the Helmsley Charitable Trust. But we've trained a group of individuals who are not only expert simulation trainers, but are experienced truck drivers now, who go out on the roads of Nebraska. And so at any given time, we've got 4 trucks out on the roads delivering this education.
That's amazing. What a great foundation. What a great way to put forward charity dollars like that. I've never
particularly focused on the rural communities.
Yes, that's what's beautiful about it. And you're teaching men to fish. You know, you're not just doing the work for them. You're showing them how to save other people's lives, which is beautiful.
Each of these trucks is based at one of the UNMC campuses around the state. So they don't just drive out from Omaha to rural areas. They're actually based around the state in the rural areas. So they really become, again, part and parcel of those communities.
Excellent.
And it helps these individuals who are the primary responders because, you know, if you're going to get called to a farming accident or motor vehicle accident or something like that, you need a sense of confidence and in your own abilities and your skills, and practicing them in a non-stressed environment is really a very important thing to do. So we have found that not only do we meet the educational training requirements that these people have to maintain their skill sets, but it gives them a sense of confidence that really allows them to maintain that role in the community, which is really important.
Yeah, you're taking some weight off the first responders as well. That's right. What a well thought out plan.
And we go to them. They don't. You know, in the rest of the world, pretty much they would have to come to a center to get that training. Whereas this way, it's on wheels.
Amazing. I love that. Okay, we're going to go back to the phones and talk to Celine from Missouri. Thanks for the call, Celine. Go right ahead.
Oh, thank you for having me. I just wanted to say thank you and congratulations for having such a stellar program there. Our son is a student there, in the laboratory, clinical laboratory scientist/technician program. He already has 1 degree, but now he's working on this there at your wonderful campus. And he is just astounded by the level of professionalism there in the buildings, especially with the staff, loves the camaraderie among his peers, and how your program is just, fueling him for success. And it's so neat how you'll pick up, different pods of these students through the Midwest and I believe South Carolina also, and pull them together and teach them so well. And like he will probably go back into the rural setting and help in that undermanned facility, because I know there's a great need for those clinicians, those laboratory people right now. And I just want to say thank you, how much we all are so impressed with your facility there and teaching methods.
Well, thanks for your kind words, and we certainly congratulate your son on his education, and I look forward to handing him his degree in the not-so-distant future, because that's part of one of the best things that I get to do is to officiate over all of our commencement ceremonies. Clinical laboratory sciences, those are the healthcare professionals that run the lab work that we all depend on every day to make life-determining decisions. And you're absolutely right. The rural communities are desperate for these people, and so are the large hospital systems as well. But I'm sure that he'll find a great community to serve, and I'm sure that also he'll get a really good education.
Absolutely. Okay, we don't have a lot of time left, but I want to make sure that we talked about the future of medicine and artificial intelligence, how that's coming into play.
So let me start off and just to say that we believe that the use of advanced simulation, virtual reality, artificial intelligence, high technology is going to be key to the delivery of healthcare, but also key to the educational systems. I mean, if you think about everything from the sophistication of video games and the use of three-dimensional imaging there, translate that into high technology surgery. Think about what it would mean if an orthopedic surgeon could stand inside of an arthritic joint that she or he was going to fix the next day and study the deformation, the abnormalities that occurred in that joint. Think about what it would mean if you and I could be as close as I am to you, and one of us could be virtually present 3,000 miles away to assist in a surgical procedure in judgment. These are the types of things we're doing, and we are currently building the Davis Global Center, which will be approximately a 200,000 square foot building dedicated to the use of this very high technology, virtual reality imaging for teaching, for research, and ultimately for the delivery of healthcare. And in our nursing programs, we've actually had the experience of using this technology to connect all of our nursing campuses.
Wow. So as a matter of fact, our viewers could see a picture of that right there. The wall that the young woman is drawing on or writing on is an eye wall. And we've been buying these starting with our Scottsbluff campus on the Wyoming border. This particular event connected Scottsbluff students with Omaha students, and you can kind of get the sense from looking at the size of that wall. Students can work together in teams, in groups, touching the wall, pulling up information, sharing it with the person on the opposite side.
Okay, that is really outstanding. All right, thank you both so much for joining us, and we really appreciate you for joining us as well. If you'd like more information, maybe you have a question that didn't get answered tonight, you can send those to us, email today@unmc.edu, or you can also give them a call during regular business hours. The number to call is 402-559-4353. I want to thank both of you once again, both so much for coming on. And you know what? We have a bright future together ahead. And so we look forward to doing more with you here on Rural America Live, hopefully making you a more frequent guest, if not someone who comes back once a month if we're lucky. So we look forward to that. I just want to thank you again. Good night from Rural America's most important network. We'll see you next time.